Hello and welcome to my YouTube channel. I hope you've been able to watch previous videos and you have subscribed. Today I'll be speaking very briefly on rheumatic manifestations in diabetes. Rheumatic manifestations in diabetes. Now, many times when we think about diabetes, we think about it as simply a sugar problem, and that's somewhat correct, but over and above the sugar issue or sugar control, diabetes mellitus can also affect the musculoskeletal system. And so today I'm mentioning just 5 conditions that are associated with diabetes, rheumatologic conditions. Number 1, flexion tenosynovitis. Now, the tendon is that part of the muscle. A muscle ends as a tendon and then connects a muscle to a bone. That tendon is surrounded by a sheath. Okay, that sheath is like a tubing through which the tendon moves in and out. So if for any reason, as could occur in patients that have diabetes, that tendon becomes inflamed, or the sheath around which the tendon moves around becomes inflamed, you would have a situation where the patient moves the hands. Let's assume this is the finger that's involved, puts the hands forward, brings it back, and then the finger actually hooks or remains in that position, and the patient has to literally use the other hand to straighten it out. And that's called flexion tenosynovitis. So tenosynovitis is inflammation of the synovial sheath around the tendon. So tenosynovitis, flexion tenosynovitis. Number 2, Dupuytren's contracture. In the palm, there is a sheath called, or a form of tissue called palmar aponeurosis. If for some reason, like in diabetes mellitus, that tendon sheath or that sheath becomes quite thickened, it will pull in these fingers, 5th, 4th digit, and then the hand looks somewhat in this position. We call this situation Dupuytren's contracture. So number 1, flexion tenosynovitis. Number 2, Dupuytren's contracture. Number 3, diabetic stiff hand syndrome or chiroarthropathy. Now, usually I can put my 2 hands together and you don't see a space in between the 2 hands. In patients that have diabetes mellitus, they could have a situation where they develop inability to fully bend their hands, what we call extension, and so when you ask them to put their hands together, their hands look like this. You see a space in between, and so we call this the prayer sign. And that's a form of stiff hand syndrome that occurs in patients that have diabetes. In addition to that, they could also develop what is called the carpal tunnel syndrome. Now, at this point here, there is a tissue called the flexor retinaculum, like a band around the wrist, through which tendons and nerve crosses. There's a particular nerve that crosses there called the median nerve. If for some reason there's inflammation around there, that space becomes too tight, and so the nerve itself becomes compressed. When that nerve is compressed, patients will have abnormal sensation, tingling, numbness in 1, 2, 3, 3.5 digits of the hands, because that nerve that crosses that canal, so to speak, is compressed, and so we call that carpal tunnel syndrome. So we've looked at flexion tenosynovitis, we've looked at Dupuytren's contracture, we looked at diabetic chiroarthropathy or stiff hand syndrome, we've looked at carpal tunnel syndrome, and then also involvement of the shoulder in what is referred to as adhesive capsulitis or frozen shoulder, where the patient presents with shoulder pain, stiffness, and then loss of range of motion. Now, usually you can move your hands, take your hands above your head, move it in different directions, but in these patients, the shoulder, it's frozen. The patient finds it difficult to make very basic movements that you ordinarily will be able to do. And so what's important to mention in this video is the fact that diabetes mellitus is beyond just simply controlling the sugar. It's for us to be aware that complications could arise from diabetes that could involve musculoskeletal system. If you've learned something, subscribe and see you next time. Bye.